The healthcare system is in a state of flux and change. We're moving from a fee-for-service environment where we treated people who were acutely ill to now we're trying to help people stay healthy and manage their illnesses long term. Most people, their illnesses are not curable. Right? We cure infections, we cure broken bones, but most other things human beings have to manage over the course of a lifetime. So the thinking in developing an institute like this is that you're going to take care of people and help them to manage their illness and prevent hospitalization. That's changing the model of care, turning it on its head from treating them in the hospital to now trying to help them stay healthy and out of the hospital.
To be a part of something new and of this magnitude is really exciting. The goal is that it will be an integrated, comprehensive psychiatric behavioral health center where psychiatry will be integrated with clinical and medical care, and substance abuse, about 50% of our patients, whether it's psychiatry as the primary diagnosis or substance abuse as the primary diagnosis, cross paths. It's almost like you have a patient who is never truly psychiatric, who have secondary illnesses that need to be addressed at the same time. In the new institute, the service and care we will be providing will be tailored to that person, meeting that person and providing an integrated care. It's not done anywhere else, so it will be a first of its kind. I really look forward to it.
The innovations that most excite me are our attempts to become integrated with our medical surgical colleagues, with the emergency departments. We were siloed off. The world of addictions is often a secret. It's often people don't talk about when they have problems and when they've overcome them or managed them. And the world of addictions treatment is siloed off. We're trying to change that. We're trying to make it so that people can come in. If you come into the emergency department, oftentimes there is a problem with alcohol or drug use that leads you to the emergency department. But when that acute physical illness is dealt with, then what? If we don't allow people easy access for treatment of their substance use disorders, we're not really meeting their needs. We're not preventing them from coming back into the emergency department. So that's one of the big changes, is to really integrate with medical, surgical, and psychiatric colleagues.
The services to be offered are psychiatric, chemical dependency. We have the biggest OTP, that's opioid treatment program in the nation. Our psychiatric services are, we have multiple units. We have inpatient detox, outpatient detox, inpatient rehab, inpatient psychiatry, outpatient psychiatry. Like I said, integrated care, which means medical care will even be provided. It's going to be like a mecca of psychiatry and behavioral health. So the benefits to the patients is that it's more like a one-stop shopping for the patient. The psychiatric care, the chemical dependency care, medical care, if they need ECT, the array of services that a patient needs will be provided in the same building.
What makes me most proud to be a member of Mount Sinai, to wear the Sinai badge, is that it's an attempt to create a system of care. I grew up initially in what are often referred to as mom and pop operations, and they're quite wonderful. But when you're trying to provide care on the scale of New York City, you have to have a system of care. You shouldn't get different treatment if you see Dr. Fiori, or over here you see Dr. Mitchell. It's not that we all have to be in lockstep, but there has to be some standards. And Mount Sinai sets the standard of care and insists upon that we're striving to be the best.
The value placed on hard work is really, it's unlike anything. You have to aspire to be better, to actually understand your work and your role better. If you're a hard-working person, dedicated, really patient-centered, and you have good interpersonal skills, you will be successful.